Good afternoon, friends. It is with great pride that I want to inform you that today I am sitting with Dr. Sabha Ahmed, who has scored rank 69 in May AIIMS 2018, rank 34 in PGI, rank 11 in JIPMER, and rank 9 in NIMHANS. Heartiest congratulations, Dr. Sabha.
Thank you so much.
So, how are you feeling today?
Elated.
Okay, so all such a good ranks. This once again emphasize the fact, friend, that toppers always choose DBMCI. So, Dr. Sabha, how was your experience with DBMCI? Would you like to tell to our viewers, you joined DBMCI as a regular batch student in Bangalore?
Yes.
So, how was your experience, overall experience with DBMCI?
So I think joining DBMCI was one of the best decisions I made. And what DBMCI does is, even the test series, even the knowledge which we are given in the class, the notes, everything is very conceptual. So it helps us crack, like people like me who wanted to join only centrals. So it helps us crack the centrals very easily because the concepts are very clear, the notes are very concise, and the test series. So it's a package overall.
Okay. Consider yourself before joining the DBMCI and once you have finished your course, the 19 subjects that we give as a package along with other things, and after that. So how do you think, how much change was there in your preparation before the course and after the course?
So usually what happened with me was I was not very strong with the first year subjects. So joining DBMCI, my first years became very strong. So that one lacuna which was there, that was filled, and the short subjects. So these things packed with medicine, surgery, OBG, and the rest of the other subjects. So I could see myself as one of the top rankers if I did the test series well, if I did the notes well. So like I said, it's a package. Once you know where your lacuna are, you start filling it up by attending classes, by doing the notes well. So that's where I think
So were you regular with the classes?
Definitely.
You attended all the classes in a regular way.
Definitely.
Okay, and any specific subjects that you want to mention that were extremely helpful for you during the course?
So like I said, basic sciences, the first year and the second year subjects, obviously everyone knows anatomy. Dr. Ashwini sir is brilliant. And apart from Dr. Ashwini and also Dr. Praveen sir, who took pathology lecture for us, I found Shivika ma'am's class very useful, and even the pharmacology lectures were brilliant. Sir started off with concepts. He started with ANS, one full day for ANS, and ANS is what they ask in AIIMS, and most of the centrals, even JIPMER and PGI, they ask a lot on ANS.
Even in NEET also.
NEET also, so absolutely. So concepts were very clear, and Tamim sir is brilliant. Like nobody can teach medicine.
That's true.
And radiology, I told you, I was remembering you when I was giving the paper. I was like, yeah, sir told this. So radiology has become a very rank deciding subject in papers like JIPMER. JIPMER has always given more emphasis on radiology, the nuclear medicine.
But in nuclear medicine, radiotherapy,
yes, sir.
A lot of radiotherapy.
No, none of the other institutes.
Yeah, that 131 again was asked this year.
This time. So all of that was very helpful. So, absolutely.
Yeah, I mean, so this is what our pattern is, that rather than just giving the mugged up content to the student, we always try to build up the concept of the student.
That's true.
Because in all our classes, not just radiology, in all our classes, we believe that it is the student, it is the concepts that take a student forward. Because anybody can mug up from the books. So that the facts are definitely there, but unless a student is not focusing on the concept, the whole purpose of giving them a class is totally gone.
That's absolutely true.
Okay, and were you regular? There are a lot of things that I just want you to tell to our students about the importance of, because I remember that you were very regular with the post-class test.
Yes.
So what do you think is the importance of the post-class test in your preparation?
So I think after you finish your subject, it's very important to gauge whether you have grasped what you have to grasp or not. So that you will understand only once you give the paper. If you don't give a test paper, you don't know where you stand, and you also don't know if you have grasp the amount of knowledge which you need to crack an exam. So that way post-class tests are very important, and beyond that I think the GTs are even more important, because you're sitting every month giving a paper of 300 questions for 3 hours. You're applying all the possible knowledge you have, the knowledge which you have from medicine, surgery, OBG, pharmacology, you're amalgamating it and giving a GT. So more than
tells you where do you stand basically, and how can you improve.
Yeah, and you have 5,000 strong contenders giving GTs every month. So if you do get a rank in the top 100 or even the top 50, more important is how you progress. Even if you start from a 500 rank, but if you're getting in the top 10 or top 20 at the end of October or November, then you know ki yeah, I'm in the right track.
So that's what I just want to tell to our students, that don't get disheartened that if you're getting a later or not a decent rank in the GT, that's basically a mirror that you're seeing, and ultimately you have to show an improvement on that so that you can reach to that particular path. Because like if on the GT, it's such a true reflection of your preparation, and if you're not performing so well in that, ultimately you are getting an idea at a much earlier level, which you can improve so that you can get a much better rank in the exam.
And in the review of the GT also, like we get a review of how we performed in each subject.
Yeah, that's an artificial intelligence that we specifically incorporated.
So we can build on those subjects, like okay, my pathology is not that strong, now I have to work on pathology, give some extra time to that. So that is a very helpful like aspect.
And what about the app? Were you regular user of the app the DBMCI provided to the students? Did you find it user friendly?
Very user friendly. So I gave all the AIIMS mocks on the app, and I found the discussions very helpful. Everything was really good.
You were looking at the video discussion? We had video discussion.
Yes, sir.
Were they useful?
Very useful, sir. For me, I am a visual and an audio visual learner. So if I hear someone say something, I retain it better.
Okay.
So it's better to read, it's better to hear those discussions than to read it on a solution. You tend to forget it, or you may just leave it because it's sort of boring. But video discussions are very engaging that way.
So they were found the quality was good.
Very good, very good.
Content was good. Okay, all right. And what about the Premier group? Were you a regular member of the Premier
group?
Very
regular, sir. I think if you like just type my name on the group, you will see the list of questions I've asked.
I remember. So did you find it useful during your preparation?
Yes,
what was the frequency of the answers that you were getting?
So very like you don't even turn the page, you get the answer immediately. So that is how useful it was.
So we are working very hard on that, and we make sure that a student get a genuine and the most correct answer. Usually
also gives the reference from where.
Yeah, that is what we totally believe, because what I think makes no sense unless I am backing up with a particular reference. We are very clear on our classes that that whatever information that is being given to the student is genuine and authentic. True. Because unless it is not genuine or authentic, just on the basis of what I practice in my clinical practice cannot make the answer of an MCQ. So it should be backed by a reference. So in all our answers, we try to back it by a reference. Just to sum up, Dr. Sabha, you were our exclusive face-to-face student who has attended all our regular classes at our classroom center in the Bangalore, and you found the course to be pretty useful.
Yes, very useful.
If your juniors will ask for a suggestion, do you think you will recommend DBMCI to your...
I've already recommended.
You have already done that.
Already recommended.
All right. Thank you very much, Dr. Sabha, and once again, congratulations on your amazing rank.
Thank you, sir.
Okay.